Okay, good morning, everyone, and thank y'all so much for taking a few minutes out of your morning to join us to learn about the Developmental Screening Toolkit and some of the guidelines as well. My name is Dr. Teresa Northington, and I am the Developmental Screening Coordinator here at the Bureau of Family Health for the state of Louisiana, and I will be your trainer this morning. As we go through the training, if at any point you have any questions, please just drop them in the chat or the Q&A section, and I will try my best to answer them as soon as I see them or at the end of our session today. So just a little quick disclosure, my name is Teresa Northington, and I'm the faculty for this educational event, and I have no relevant financial relationships with eligible companies to disclose. Okay, let's get started. So to begin, let's take a quick look at our overview for today's training. We'll begin with a quick look into the developmental screening guidelines and a look back into the creation of the developmental screening toolkit. To better understand the toolkit, we will break down each of the steps and components, followed by some ways in which you can implement the toolkit into your practice. And lastly, we will take a look at some resources available and take any questions that you might have to conclude our session today. So let's begin. So in 2015, the Young Child Wellness Collaborative, composed of experts from all areas of child health and development, convened to create a homogeneous set of guidelines for developmental screening. The guidelines were created in accordance with the recommendations from the American Academy of Pediatrics, Bright Future, using their periodicity schedule as well. These guidelines outlined 5 predominant areas along with the most validated and appropriate instrument or instruments to be used for each screening domain. Although most screening domains only have one shown there listed, there are additional screening instruments that are also validated and approved for reimbursement through Medicaid. As you see in the graphic, the 5 domains are general development, autism, caregiver well-being, social emotional health, and social determinants of health. To help practices implement the screenings, the Bureau of Family Health developed the Developmental Screening Toolkit. The toolkit is located on the BFH website and is available free of charge for use. Please also, if you can, let me move myself out the way there. Snap a picture of the QR code in the corner and it'll take you right to the toolkit's website page. The toolkit is a 3-step process that will help implement the developmental screening screeners and initiative into your day-to-day operations. With a focus on quality improvement, the toolkit seeks to help practices modify and or improve the way healthcare is implemented in their practices with training, support, office hours, and a host of other resources. So a really, really great resource that's free for everybody to use and comes with the support of me, the Developmental Screening Coordinator, to help you at any point along the way to make sure that you all feel comfortable implementing these screeners in your practice. So let's take a look. Now that we've seen where it's located, we can take a look now at the features, starting with the 3-step process for implementation. So here we have just kind of where it's located. When you want to get started, you want to just kind of dive right into it. You can go directly to the Bureau of Family Health website, and you'll see here the toolkit page. It's a great place to start. When you want to improve, implement existing screenings, kind of restructure, optimize staff for developmental screening purposes as well. There you can find plans, resources, and anything you really need to assist you to carry out the practice of developmental screening and to just kind of provide some assistance and help serve your families as best as possible in this area. So there you'll find everything on the website. From each step has its own page. Then you'll see training and support, a little tab for resources as well. So each thing there you'll see has a really great web page to help you out. Okay, so now we're ready. We've seen where it's located. We kind of know what it's for. Now we'll get into the steps. So for step one here is to begin the process of implementing the screenings into your daily routine. We first need to assess the capacity you currently have to carry out the screening process. We will identify the main roles, tasks, and see who on your staff can complete each task and occupy each role. So to do that, we first need to form the team. So to do that, we have identified 4 basic roles that you will need. The first role you can see here is the champion. The champion is someone who is going to lead and sustain the efforts to successfully implement developmental screening. This person will need to provide education and support the rest of the team. And pretty much that's going to look like it being the nurse practitioner or the physician at your practice. Could be both, of course. Next, we have the practice manager and the administrator. And this team member is super important to help the team determine how to really fit developmental screening into your workflow, documentation, and billing. So the overall goal here is to make sure that through these 3 steps, we are kind of incorporating and merging kind of a new process with an old one. And we want to make sure to do that it kind of goes in there seamlessly. And the practice manager and administrator is going to be crucial in that, because they're going to be the ones to kind of make sure that even though these new developmental screening results and documents are they're new and they have to kind of go into it, they're going to make sure that they're properly documented, that they're put into the files, that the billing is done correctly, and nothing kind of falls by the wayside. The next role we have is the clinical staff. And these are the nurses, medical assistants, and often also the front desk staff. And they're going to conduct medical assessments. Their roles in developmental screening can include administering more sensitive screens, scoring the screens, answering questions, and starting conversations with patients and families about developmental screening. So they're also, they could be also in charge of just kind of starting the overall process of checking the families in and starting their screeners if they're going to be doing them right before they actually have their well-child visit. And lastly, on the team, we have the physicians, and they're the providers with medical authority that must, of course, be involved. And they must really buy into the developmental screening initiative and follow the changes and everything that's kind of going on around this topic. And of course, the parents parents and caregivers really rely on physicians and their expertise and guidance when making decisions for their child. So they're going to be looking for them to kind of provide all that information, the guidance, the referrals, to update them, to kind of follow up with them around this area, because for many parents and caregivers, this is going to be something new, and they're really going to be looking for that guidance from those physicians. So staying up to date and really kind of taking an active interest into this, this initiative is going to be crucial for them. Okay, so once we've assessed our kind of staff and we've seen who can occupy these positions, we're going to see, well, do we have what we need to implement the tools? And not just the team, but do we have all the necessary spaces? Can our office kind of accommodate? Do we need to do some modifications? Do we need to change some things around so that we can best serve all the families in the best way we can? So that's what we're going to be calling the assess capacity, and kind of developing strategies for that. Basically, just taking an inventory of your staff and figuring out if the current staff and roles and duties are sufficient to carry out the designated tasks, or if some modifications need to be made. During technical assistance sessions with myself, we can also go through the process in detail to assist you with identifying, allocating roles, and kind of getting some descriptors ready for those individuals, and also mapping out what it's going to look like in day-to-day functions. Because of course, right now, if you're not really implementing many screeners, or if you're not really doing them yet, it's going to look different. So we want to make sure that we kind of map out everything so that everybody has a clear-cut view, an idea of what they're going to be doing, how they're going to be doing it, and how their roles are going to change based on what kind of role they're going to be occupying in this process. So the next thing that we're going to do once we've created this team is we're going to identify when and where you'll screen. Super important because you're going to be adding on kind of like a new task. And of course, we know that your clinics are probably full already. Your practices are kind of bursting at the seams with people coming in and trying to find space. So we want to make sure that we also identify where this is going to be done. So the clinic staff can help out and determine which space could be best utilized for filling out the initial paperwork, caregiver screenings, documents, any of the things that are going to be needed to really get this process started. And for the most of it, we can identify that it could either be in a public or private space. In a private space such as a designated room, or simply for a private space, a designated room, or for a public space such as a waiting room. But we also want to make sure that we kind of take into account that some caregivers may also need extra assistance with reading and kind of filling out those documents. So we might also just in the back of our minds, even if you don't have a space all the time, just to kind of make sure that if that caregiver does ask you for assistance, that you have somewhere in your practice that you can kind of go that might be a more private space and a quiet space so that you might be able to assist them, because that is a thing also, that sometimes those screeners might be a different language or they might have trouble reading or seeing. So we also want to make sure that we help out as much as we can those caregivers completing that screen, because we want to make sure that the screening results are as accurate as possible. And to do that, sometimes we might need to provide a little bit more assistance. The last part here for step 1 is to begin project planning and developing those strategies for developmental screening in your practice. And basically, now that you've identified the roles, the team, the responsibilities, we're going to now take a look at what will this look like in real time. How long will these tasks actually take, and how can they be integrated as seamlessly as possible into your current routines? For example, it's pretty much just like, what will this new well-child visit look like? So we had the old one, but now that we're taking this kind of like interest in these screeners, those well-child visits are going to look a little bit different. And we want to make sure that we are making the best use of time, space, resources, individuals, staff as possible to carry out these visits. So once we've identified that team, now step 2 is to train the team. So to train the team, the plan has been created, the team identified, and now it's time to train the team on each screener, what it is, how to give it, how to score it. And this is where I come in. So a lot of times we know that can be kind of like a barrier, because of course you guys are all strapped for time, you're moving quickly, you're booked up all day. So you're like, well, I want to do these screeners, I want to implement them, but we just don't have the time to take the trainings, to give the trainings to everybody. So no worries, that's where I can come in and I can assist with that step. As a developmental screening coordinator, I'm able to assist you and your team by training your staff on each of the screeners, from the basics of just what they are and how to give them, when to give them, how to score them, and providing you and your team with resources to pass along to the families in need. Because we want to make sure that everybody feels comfortable in this process. And sometimes you don't feel comfortable when you don't know exactly what it is. You don't feel comfortable answering questions that parents might and caregivers might have calling in. And so we want to make sure that everybody feels as comfortable as possible, because that also goes into the seamless transitions and the flow of the overall visit, when people feel that they have that level of comfort and in the whole process itself. So this process all begins with the screening instruments. And here on the graphic, you can see which instruments go with which domain. And the next step is to familiarize the team with the ways in which they can assist families with these tools. So here we have the general development. The tool for that is the ASQ3. For autism, it's the modified checklist for autism and toddlers, revised with follow-up. For caregiver depression, it could be a couple of them, the PHQ2, the PHQ9, and the SEEK. For social emotional health, it could be the ECSA or the ASQ-SE, which is the social emotional 2. And for barriers to health, it can be the SEEK. So for each of these, I am very, very happy to provide your practice with trainings on each of them, how to score them, how to, if parents and caregivers need assistance filling them out, I can help in all of those ways to kind of make it a little bit easier for you guys to implement them in your practice. Okay, and so once we have the team trained on all of the different domains and the different instruments, we go to part 2, which is pretty much making sure that that team is comfortable having conversations with the families and providing referrals and kind of moving the families on to the next steps. Because sometimes, we know that you guys, you're super busy, and we want to make sure that everybody's receiving the same information, and that is the same accurate, the same verbiage, the same conversations to each family. And we can provide staff with some scripted options so they don't feel like they have to come up with what to say, and they're kind of in that space where they don't know exactly what to say, but they want to inform the families, but they don't want to say too much, too little, the wrong thing. So we can definitely provide your staff with more scripted options to guide them in their conversations with families before, during, and after screeners are given, thus making sure that the correct terms, information is given to each family when a child is seen as at risk or not at risk. And lastly, we can also make sure your team feels comfortable providing resources, because of course the families, if the child is identified as having risk for either any of these domains, they're going to want to know what they can do, where they can go, and they're going to look to your staff to kind of guide them. So for that, we're also going to make sure that everybody feels comfortable with the conversations with families, providing resources, and actually having those resources to provide. That's a big thing, because sometimes it's hard to identify, to find them, to make sure that they have kind of been vetted and having the time to do that. But the great thing about the toolkit is that we have also already identified resources. We have referral guides and all the things that will make it a little bit easier for you guys to pass along the information to your families, to kind of just ease that burden on everyone. So you want to make sure that everybody feels comfortable in this process. And when the families feel, of course, that you already have that information ready, they're going to feel a little bit more at ease, because they know that you've already taken an active interest, you've taken the steps to make sure that they are well informed and they have the information that they need as well. And step 3 we have here is to implement the plan. So once you have identified everything, we have the team, we have the spaces where the screeners are going to be conducted. We know exactly who's going to do it, when, where, all of those things. We're going to put this plan into action. And before, of course, you do any plan, you're going to want to make sure you do a little test run. So for step 3 is kind of like the test run to see if it works or not. And this is what we call the plan, do, study, and act process. And the little graphic here on the left will show you a worksheet that we have on the website. It's a fillable PDF, so you can kind of put in what we have mapped out. We can do it together. You guys can do it on your own in your practice. And then that's going to kind of serve as the guide to make sure that you're following it. And then if something, kind of goes to the left or goes awry, you can kind of go back to it, make your changes. You can document the changes so that it's not just kind of on the fly to see what's working, what's not working, and you just kind of don't know, you don't remember, because Liz and I have to write down everything. And I know that some people are the same way. So this is kind of a write it down, go back to it, modify it, look at it to make sure that everything is working properly. First step to do that is develop a test date and make a prediction. So you say, you know what, on this day, we're going to try it out. We're going to put out all the parts into motion. We're going to fill out our plan here. We're going to kind of do a test run. And then the part two for that is the do. You're going to conduct that test and you're going to collect the data. You're going to say, you know what, we tried it on XY date and we're going to see if it actually worked. We're going to collect that data, see how long the actual well child visit took. How long did it take for you guys to complete it with all of the new components from start to finish? Part three is we're going to study, we're going to analyze that data, and we're going to come up with our results. We're going to come back to that sheet. We're going to see if there's anything that we can change in part four, which is the act. We're going to make the changes for it. We're going to try it again. We're going to see if we can adapt some things to kind of make it a little bit easier. We're going to maybe adopt some new things, and we might just abandon some things, say, you know what, that didn't work. We're taking that out, back to the drawing board, and we're going to do this as many times as possible as we need to make sure that everything goes as you will need it for your particular practice. Because of course, all practices, all clinics, all sites are different, and we want to make sure that we develop the best plan for your site, for your families, for their needs as well. So we fill it out, we go through it. You know, if you need some more assistance, you say, you know what, we filled it out, but maybe we need a little bit more guidance, and I'm here to help in any of those stages and any parts of this three-step process, especially this part here, where we can kind of look in, analyze, plan together, and kind of see what's going to work and what maybe needs to be changed. So once we've done all those things, all those steps, the last step here is just to take a look at those resources for the families. And we have resources for families and providers by region. So we've kind of taken that off, you guys, and you guys can come to this website. You click on the resources tab and you'll find referral guides for each region, because we know that they're different depending on where you live. And you'll find on the resource guides for each region that they focus on general and social emotional development, autism, and family wellness. So you click on those, you click on that resource tab, and tons of resources will come up that you are able to just print out, make copies of it. And when a family is in need of those resources, you're able to just take them easily from your little, maybe you have a little folder or whatever it might be, and hand them out, so you don't have to sit there and kind of look things up. No worries, we have them all for you. And of course, if you're in need of any other type of assistance, I'm here as well. I can be contacted via email and to provide those trainings for you and your staff at any time. So if you need that, you know, you're really excited about this, but you're not exactly sure how to begin, I'm here, and I'll be here through all the steps of the process to make sure that you guys have everything that you need. And that's pretty much it. That's the toolkit, kind of in a little concise way. I hope that something that you guys have heard here has been useful, and that if you didn't even know what it was before you came here, that you know that this is an amazing and helpful tool for you, for your families, for your practice. And I just hope that it can provide you with some assistance in implementing the screeners, because they're so important in the lives of these children and the families. And they're going to really thank you and be so grateful that you guys took the time out to develop this plan, although it might seem a little bit kind of like time consuming, but the result is going to be amazing for the families and the children that you guys are serving. So I thank you all so much for coming. I'm going to take a look in the chat and see if we have any questions. If you have any, please drop them in the chat or the Q&A section. I'm going to take a look real quick. And also, if you're seeking here CME or CE credits, please, just after our session is done today, to make sure to fill out that survey so that we can get those certificates to you. Let me take a look here and see if we have any questions about anything. And if you have any questions later, please always feel free to email me or give me a call or whatever, and I can provide the slides for you. And a little bit later, we'll also be putting up this presentation on our YouTube channel, so it'll be available for you to take a look at whenever you need it. See, I don't have any. Do I see any questions here? No questions. You're very welcome for the information, and I hope it's helped you all a little bit. And if you need anything else, please always let me know. I'm here to help. That's all I have for you guys today. Thank you so much for coming and this morning. I know y'all are all busy, so please have a wonderful day. And I look forward to seeing you guys later to help you out with anything related to developmental screening. Thanks so much. Have a wonderful day.